Now to COVID-19. Governor Eric Holcomb said today we are suppressing the surge in the fight against the coronavirus, but we have not hit the peak just yet. The governor said today this week is critical.
We're looking at the whole big picture of the state of Indiana, and what we've determined is this is a critically important week for us, and we need to finish it strong.
I would agree, Governor, and I think we hear a lot of national talk about what's good for the coast to start doing, like New York City or California, but realistically, the Midwest is in a different place, and we really need to look at what Indiana is doing with regards to the numbers and what our surrounding states are doing.
So let's take a look at the numbers here in Indiana. The state health department said 387 Hoosiers have now died, 37 since yesterday. More than 8,500 Hoosiers have tested positive. 46,000 people have been tested. Governor Holcomb was also asked today about the president's statement yesterday about reopening the U.S. economy by May 1st. The governor said today the president is aspirational, adding it'll be a partnership and that they will work together.
And there are also some new recommendations tonight to really address the disproportionate number of African Americans who are dying from COVID-19. In fact, Black Hoosiers account for 20% of the coronavirus deaths statewide, but represent less than 10% of the entire population. Our 13 Investigates reporter Chandra Chapman tonight shows us why some lawmakers say they now want strategic testing, treatment, as well as outreach.
The percentage of African Americans dying from coronavirus in Indiana is troubling. It claimed the life of 47-year-old Gary Smith, a husband and father with no pre-existing conditions and full health coverage. His wife, Rhea, believes Gary was exposed while working, making deliveries for a beverage company. He sought out testing at an emergent care center, but was sent home with meds for the flu. 3 days later, he was hospitalized. Within a week, he was gone.
When this population is sick, we must stop sending them home alone.
The numbers and stories prompted Indiana's Black Legislative Caucus to propose new recommendations to slow the spread of the virus and save more lives.
We would like to see testing and triage centers placed in Black neighborhoods.
Staging drive-through testing sites like those provided by Lilly could mean earlier screenings.
How are you proposing to go about getting more testing or triage into certain areas?
If they can drill down that data even further by zip code, like some of the other states, that will let us know within the county and then where by zip code we can place some of these testing centers.
We're going to have more numbers when it comes to African Americans and zip code and those numbers here in Marion County.
Lake, Allen, and Clark counties could also benefit from zip code data. The caucus says outreach is just as important for prevention and self-care.
To help spread the word about staying at home, about seeking medical care, to increasing funds for public health. African Americans have a higher rate of chronic disease.
And for those who can't afford to be sick,
implementing paid leave will help essential workers seek the medical care they deserve and reduce the potential spread of the virus.
Data-driven recommendations the caucus is asking the governor to act upon.
And we're going after that data. The more that we know, the more that informs us on how to address this issue, whether it be disparity or inequity. So we're hot on this trail as well.
A long line of hungry Hoosiers went home today with armloads of food. I want to show you what it looked like at GLEANER'S today. National Guardsmen were there distributing tons of groceries to more than 1,400 families. Now, since this COVID-19 crisis hit our state, the food bank has been giving away much more than twice as much food. Families are struggling with layoffs, reduced work hours, kids moving back home. And in the long lines of cars, we found the Carter family picking up food for their parents and other relatives.
They have no food at all. We dropped off a box 2 weeks ago, and now their box is about done, but they were so thankful. Thank you so much for being here. I just keep telling everybody thank you for being here.
GLEANER'S food bill has jumped by more than $500,000 a week. The food bank needs to raise another $6 million to keep this program running through September. So if you'd like to help, we put a link to GLEANER'S. It's on WTHR.com.
And speaking of helping out tonight, a Greenfield auto parts manufacturing company, they're also now stepping up to help make intubation hoods to help local hospitals as well. Take a look at this. One employee at Key in North America, they noticed a Facebook post asking if anyone could make hoods. Well, Sean McConnell, a design engineer at the Honda manufacturing plant, thought his company could. Well, by the next day, senior managers at the company were manufacturing 15 hoods. Today, they were back at it using donated materials to build 9 more. Those hoods are clear plastic material with holes in the back to protect doctors and nurses while they're attending to patients.